And welcome back to the show. April is National Alcohol Awareness Month, which was developed in order to increase awareness and understanding of the causes and treatment of one of the nation's top public health problems, alcoholism. Odyssey House is a residential substance addiction treatment program helping New Yorkers in need to overcome drug and alcohol abuse, improve their physical and mental health, as well as defeating homelessness. Joining me now to share a little bit more details of this is the Senior Manager and Director of Outpatient Admissions and Recovery Support Services at Odyssey House, Mary Callahan. And Mary, glad to have you here with us here on Open.
Hi, how are you?
Good, thank you. Good. Well, glad to have you with us. And as we said, nice to have you. So let's get right into it. Talk to me a little bit about Odyssey House as we talk about this particular month, National Alcohol Awareness Month. Odyssey House is front and center in confronting those with the issue of alcohol.
Right. So Odyssey House is a multi-service agency that's been operating in New York City since 1967. And we treat alcohol and substance use disorder as well as co-occurring mental health disorders from the very lowest level of treatment, which is non-intensive outpatient, all the way up to intensive residential treatment. We also provide community-based services in the form of our recovery center and our home and community-based services. So that way we are able to engage folks who may be struggling with alcohol use disorder from the very at the family level in the community and all the way up to referrals from the court system. Alcoholism in particular has increased tremendously during the pandemic with a noticeable impact, particularly on women, increasing up to 19% of chronic alcohol drinking. And the thought behind that is that because many women have lower level jobs and also are required to be the primary caretaker for the children, they have been managing much more and often in isolation from their homes. And this is thought to have been connected to an increase in drinking in general. Additionally, there has been an increase noted in drinking for people who have co-occurring mental health struggles such as depression or anxiety, where 64% of people who identify as having depression have increased their alcohol consumption, and 41% of those who confirm that they have anxiety concerns have increased their alcohol consumption.
Talk to me a little bit about the opioid drug use, because that's pretty prevalent also during a time such as this. Give me your take on opioid drug use and some of the work that you're doing to help those that are really facing that challenge.
Yeah, opioid use disorder has been has long been a chronic problem, particularly in the Bronx. Bronx for the past several years has had the highest overdose rates in the 5 boroughs. And so it's also linked, opioid use is a substance that's linked particularly with isolation, because folks are more likely to use and not reach out for assistance. So the way Odyssey House has been trying to combat that is by really taking opioid overdose training and to the community, coming out into the streets themselves, providing Narcan training and Narcan kits. Narcan is a medication that's used to overturn overdose, so that a person anybody can be trained in the use of Narcan because it's very simple. It's just like using an Afrin nasal inhaler. You just notice somebody might be in your household or on the street under the influence, and you can just take the little spray bottle, put it up their nose, and you can throughout the Bronx, training people in the community throughout the course of the pandemic. Really, we have not really dialed back too much on that.
Yeah, and a little bit about your recovery center, because I know also you have a recovery center that's really aimed at helping people really get back on their feet. During the course of this pandemic, what's it been like for the recovery center in dealing with those who've been coming to the doors?
Yeah, so our recovery center is located at 2038 Davidson Avenue in the Bronx, right along the 4 line. So it's very centrally located and co-located within the Davidson Community Center, which has been around since the early 1960s in the Bronx and is well known in the community. Um, Initially, with the pandemic, just like everybody else, we had to learn new ways to provide services and shift to telehealth services for the most part, but always having some staff available within the center. And so we learned that we could actually reach a larger audience that way. And even now that vaccinations are here and and testing is citywide for COVID-19, we still continue to provide a mix of telehealth services as well as face-to-face services, enabling us to reach out further. So people can call in to support lines at the Recovery Center 6 days a week. People can come in anytime, 6 days a week to the Recovery Center and work one-on-one with a recovery coach. People can receive training in overdose prevention through Narcan at the Recovery Center, as well as access a food pantry, some support around vocational skills, resume writing, family support groups. We have a media night so that people can, come in and receive support throughout the crisis.
And so, for people who want to find out about Odyssey House more and the services that you provide, what do they do?
So you can go on www.odysseyhousenyc.org, and it lists all of the services that I have just described.
All righty. Well, Mary Callahan, certainly I want to thank you for coming and being with us here on Open, sharing a little bit about the work of Odyssey House, and then also what goes on throughout National Alcohol Month. Thank you so much for being with us.
Thank you, Daren. Nice to be
All
with
righty.
you.
Now, for more information, please don't hesitate to visit their website. And when you do that, you can find it out more, odysseyhousenyc.org. Also follow them on their social media at Odyssey House NYC. We encourage you, don't go anywhere. We got more show coming up. Open returns right after this.